G'day guys, Dr. Nick here from Abundant Life Chiropractic. Today I'm going to be talking about headaches and chiropractic's relationship with headaches. Now I see a lot of clients with headaches, majority of them I can really help, but not everyone. And the purpose of this video is to explain a little bit about maybe some possible causes of them and some real solutions to headaches and why you're suffering. Now, not everyone's going to be helped by any type of therapy or medication or treatment, but we try to find a common denominator and look at or break it down a little bit of this specific condition. Now, in the brain, everything is pretty much perceived in the brain, especially pain. So if you've hurt yourself, it goes up into the brain, you feel it in some type of pain or you perceive it somehow, but it's normally happening in the brain. Now, this is the same thing with headaches. Now, we look at really what could be some possible, or what is really a headache and what are some real causes of headaches. And then we talk about the relationship of chiropractic. And then if chiropractic can't help, what else should you be really looking at in really helping with headaches? Now, headaches can be a very simple thing or it can be a real complex issue. So you got to look at really where they are. So the location of it, behind the eye, behind the head, the pressure, does it travel around? Really the triggers of a headache or a migraine, the timing of it, pretty much the triggers, and the severity of it. And with maybe some causes, chiropractic we look at to see what's stopping the body from actually functioning properly. We try to be perfect and have the body just working normally, but a lot of time it doesn't. You've got to find out why it's not healing itself properly. Is there something going on there that's stopping it? Now, we look at 3 T's. So we got the thoughts, we got the traumas, and then we got the toxins. So first of all, possible causes are those. So how you're coping with life and perceiving life yourself with thoughts. How are you thinking? And so are you getting stuck with a certain pattern in your life that you're stressed out with and you think about it over and over and over and over and over and it gets a headache? Something bad really happened to you emotionally or in your life that you're sort of reliving again. You can't change something and it's pissing you off. Overwhelmed is a big one as well. So you've got just so much going on: kids, family, husband, wife, external family, job, money, moving house, property, investing. Big stuff. And you can sort of see how you wake up in the morning with it too. And then you got trauma. So how you're sitting and standing. Are you driving a lot? Are you starting to get this forward head position and leaning a lot? That's really straining the body. Have you been in traumas with sport, accidents like whiplash, falling off horses, ladders, roofs, swings? A lot of that happens when you're a kid. And this is really what chiropractic can really help with is getting the structure right to help with the pain that's associated with that and posture too. And then the last one is toxins, diet, big one. Are you eating well? Are you drinking well? Are you breathing well? Now, breathing is like smoking or some type of vaping, drugs. Smoking, alcohol, it's just not good for you. Toxins, lots of sugar. Now you can ride, the caffeine and sugar rides, where you don't have it in it, and if you've always had them and you don't have it in a day, you can get a headache. Sugar as well, those headaches is with that. Are you coming off? Are you trying to change your diet? Are you coming off that? You're getting headaches, or you're just bloody inflamed in your bowels and your body, your muscles, and you got a lot of headaches from that. So diet's a big one with your gut as well. And that can affect your mood and depression as well. So those 3 things are normally the causes: your thoughts, your trauma, and your toxins. And then you got maybe a few percent, 1 or 2% that can be some random stuff, or if you're really severe, if you have a really severe headache, you've had nothing you've never had before, then you've got to look out. There could be something going on, like a blockage in a blood vessel or something else, stroke. Now let's look at the chiropractic's role. So chiropractic's role, we look at especially the upper neck and the lower back with the tailbone or sacrum. If they're not functioning very well, they can really pull on the nervous system. And that's the spinal cord, the nerves, the muscles that also have nerves in them. They can all revert back into the brain and cause problems there. Same with the tailbone. And so hopefully if that's you, it can be a simple fix. Or it can be a combination of it all as well. And so you always got to try to improve your whole life in all areas of those thoughts, traumas, and toxins to really help with healing. Because you want the body to be healing all the time, and because there's always some type of damage happening. And if you can manage that, then majority of the time you got a good chance of getting rid of that and healing well. But if we can align the structure right in the neck and the lower back and of the whole spine, and it holds position, this is the big thing, is timing. So not always will you get instant relief. Sometimes you can get instant relief, but sometimes you might not. And it might take some sessions to actually hold the vertebra in place, or weeks, or hopefully not too long, like months, but sometimes it can be months. And then managing it as well, managing that life, the vertebra, the posture. Now, if chiropractic doesn't help in your program that you might have had, or your sessions that you've had, then you've got to look at maybe some other things and really see if you can change it. There's some other therapies like Botox and things like that you can inject into the skull, the back of the neck, to just take the pressure off the muscle. That's external therapy, which I suppose is okay, which can get results too, but you are killing off the muscle and the nerve a little bit too. And you'll have to have regular ones throughout the year. But let's talk about some other external stuff, and we look at maybe the morning. So even how you're sleeping. So that night when you go to bed, are you eating before bed? Are you loading up on some type of food, and that will create dehydration throughout the night? Are you really dehydrated throughout the day and then going to sleep, and you wake up with a bloody headache? Stiff neck, jaw problems, which can be related to how you sleep with a pillow or bed. Are you a front sleeper, which I don't recommend because you really twist the upper neck, and I can see it with people as well with the vertebrae, especially the first and second one. The second one can be severely rotated. Man, that can cause a lot of problems in the body. Now, when you get up, I don't really recommend getting on the phone and looking at news and that. It's best to have a good routine in the morning. I know it's not possible for everyone because you've got to up your kids probably sleeping with you or waking you up, and sort of got to get into it. But try not to go straight to the phone or coffee. Try to get some water into you as quickly as possible. Start getting hydrated, maybe some fresh juice if you can. I've been juicing a bit lately, trying to get one fresh juice, vegetable and fruit juice in, and it's awesome. Loving it. And having coffee a bit later in the morning, which try to have it with a bit of food, because having a lot of coffee on an empty stomach can affect blood sugar or sugar regulation in the system. That can affect other stuff as well. So your morning routine is quite essential too, and movement. So we've got to talk about a little bit of exercise. Now we're sitting all day and eating and got a lot of life, and we're not really moving much. Over time it builds up and you feel like crap, and you get this tension in the system, and you need to get it out. The only way really to get it out is to move it out. Some type of walking, lifting weights, sweating a little bit, just getting the heart rate up a little bit is quite essential. And to do that regularly, it can really help, and I really recommend that. So, and then looking at throughout the day at how you eat as well. So how you're eating, what you're putting into the body, and then how you're sitting and standing. Is your head forward a lot? This is a big problem. This is why we take photographs and x-rays too, is how if your ears level or not. but the upper neck normally means an upper neck problem. And then from the side, as you head really forward, you're getting these little humps, especially in women, they get these humps. It's just no good. It pulls on the muscle, pulls on the tissue, and it can become permanent. It's really hard to correct. So there you have it. That's headaches. So it can be an easy thing. It could be a really complex thing that could take some time and some really thought into it. Now, if you've never seen chiropractic before, or maybe as well, and you're in Ipswich, for the next 2 weeks up to the 18th of June 2023, I'll offer you 50% off the initial consult, just to get you into, just to see if I can help you or not. We'll do a full spinal check. I'll go over your history and understand a little bit more about your life. I'll take some posture photos and some x-rays if you really need them, just to see where the structure of your spine is, and to see if I can. And then the next day, I'll look over all the results, and the next day I'll have a look. I'll go over it with you and explain if I can help you or not, and if I can, I'll outline a program for you. So that's there for you. I hope this has helped. Maybe headaches. See you next time.